Hi, my name is Shannon, as most of you know already, and I'm excited to share my strategic plan for Dan C. Trigg Memorial Hospital in Tucumcari, New Mexico with you. So the purpose and vision of Presbyterian Hospital is that we exist to improve the health of the patients, members, and communities that we serve. We don't specifically have a mission, but we do have a letter that we try to abide by to provide care to our patients. And the highlighted areas, as you can see, relate to communication. And this is important because this is an underlying foundation of my strategic plan. Okay, so the strategic goals at Dan C. Trigg that I am proposing are to increase compliance with participation among physicians and nurses with daily collaborative bedside rounding on the medical surgical unit by the end of year 2018, to improve patient satisfaction scores in patient care, and also to improve communication during this process. Why should we implement this plan? Well, there are many reasons why, as you can see. Improved communication and collaboration, better patient care, and better patient outcomes. A haphazard process becomes standardized and routine. And I'll explain to you in a future slide about the standardized form that we will be using. Increased patient satisfaction, higher HCAHPS scores, improved staff morale, and improved financial reimbursement due to value-based purchasing. These are some of our stakeholders, the internal stakeholders which we will be collaborating with. And also we have the external stakeholders, prospective patients. The current patients are very important to us because they are all involved in this process and we care about their health. So the strategic map is very important during strategic planning because it helps our organization meet our long-term goals. So as you can see, we have learning and growth needs, internal business process goals, customer service goals, financial performance goals. And all of these work together to meet the goals that we are proposing here. The action plan, these are some management tactics and strategies that I am proposing. Management by objectives. This is going to help employee motivation. Employees and managers are going to collaborate together to discuss goals and progress. Management by means, this is going to help us implement a standardized process during bedside rounding. Behavioral decision-making style, this is very important and goes along with the transactional leadership style because we are all working together and communicating together. So, tactics to manage implementation and ensure success of the strategic plan. Like I say, collaboration, very important. Discussing progress, discussing concerns and issues. We will need education for staff on the standardized rounding tool, which I will show to you. Education for staff on how to record compliance. This will be most likely the charge nurse's responsibility. Periodical meetings with internal stakeholders, a task force to help promote engagement, informal rounding to monitor progress and get feedback, and emphasis on teamwork. So this is the standardized tool that I'm proposing to help with bedside rounding and to improve communication during this process. It was created by Johnson for this purpose. Communication plan. Open communication is very important. We want everyone's opinion to be valued during this process. Reaching stakeholders in multiple areas through multiple channels. This is very important. Let's face it, we don't all check our emails like we're supposed to. So flyers in break areas, email, word of mouth. Keeping stakeholders updated, providing meaningful feedback, active listening, and of course positive nonverbal communication. Formal and informal communication channels. We are obviously going to have a specific number of face-to-face meetings with hospital board, all the internal stakeholders. and external also. After the plan has gained support, we're going to also have meetings with staff nurses, charge nurses, physicians, all those on the front line, and get their input. Evaluating the plan. So how do we know if the plan has worked? This is very important. We want the plan to be effective, we want the results, and we want it to become sustained and rooted into our new culture. So compare the HCAP scores from before implementation and after implementation. Feedback from employees and current patients. Key informant interviews and compliance monitoring form. Goal details. We are going to achieve these by the end of fourth quarter 2018. I'm going to be positive about this. Implementation of the standardized rounding tool. We are going to reach and sustain a participation compliance rate with bedside rounding of 90% or greater. And we are going to increase our scores in the HCAP surveys of 90% or greater. I am proud to say that nurse communication score is already 88.9%, so good job with that. We do need to improve the physician communication score of 71.5%, and this strategic plan will definitely help with that. So that is it. That's my plan. If anyone has any questions, I am available to answer your questions. Feel free to look me up. Thank you so much.